So this is something I get asked about, and I think it perplexes some people, and it certainly causes you to shudder a little bit if you see this on your clinic schedule, and I don't want it to. And this is actually the first time I've given this lecture, and so I put these slides together just with this in mind. So, okay. I don't want this to be painful for both parties, right? The patient's already coming with pain. It doesn't need to be painful for the provider. So what are my objectives? Well, we want to get to the underlying issues, right? What's important that we can actually affect meaningful change for? And let's develop a standardized approach, right? If you do it the same way every time, things get easier. I'll highlight some key components of communication, effective clinical communication, remembering that brevity is the key. Some tips on avoiding pitfalls when these patients come into your office, and we'll try to establish a headache-free algorithm for management. So remember that perception is reality, and there are several profiles, both on the part of the patient and what can happen with you as a provider once you see that chief complaint of genital pain. So you want to avoid assumptions, right? You know what some of the euphemisms are for what assumptions are and what they're inclined to do. But if you have preconceived notions that these are just, narcotic pain seekers coming in for drugs only, you might not be open to hear their story, to treat them effectively, assuming that it's all psychological. Providers can get anxiety when you have these patients sitting in front of you there in the room and you try to placate these patients quickly, and instead of listening and hearing their story, you're already thinking about exit strategies. How do I get out of this room, right? How do I get this patient out of my clinic and onto somebody else? And then the patients can feel dismissed, and they'll show this in their satisfaction scores and then their calls to your office, right? So the same way every time. It's something you hear me say to my residents, to my fellows, and I really do believe it's a key to well-being in